The VA Medical Center in Indianapolis is among several across the country that reported a critical shortage of nurses. WRTV Investigates partnered with Newsy and found more and more nurses are getting sick with coronavirus or are in quarantine at hospitals that serve military veterans. Our Kara Kenny is asking the local VA hospital how this is impacting patients.
The Richard Raudebush VA Medical Center in Indianapolis provides inpatient and outpatient services to thousands of Indiana veterans every year. But records obtained by our partners at Newsy uncovered the hospital has been asking for help to provide adequate staffing. The Indianapolis Hospital is one of 6 VA medical centers in Midwest cities, including Cleveland and Detroit, described in a federal contracting document in December as facing a critical shortage of nurses due to RNs becoming infected with COVID-19, as well as requirements to self-quarantine due to confirmed or probable exposure.
The crisis is coming.
Yvonne Evans worries there soon may not be enough nurses to work alongside her at the VA in Detroit as coronavirus infections increase. She spoke to us as a member of the American Federation of Government Employees, Local 933.
The surge hasn't quite hit yet. After this holiday, I honestly believe these surges are going to really increase.
Nurses spend prolonged time close to COVID patients, more than doctors.
It's more intimate. We're changing them, we're bathing them, we're feeding them.
Data reviewed by our partners at Newsy from the VA shows cases of COVID among VA employees nationwide began a sharp climb in November as infections across the country ballooned. And while anyone who catches the virus can be sidelined, nurses out sick impacts health care of others. WRTV Investigates reached out to the Indianapolis VA, and a spokesperson told us that the document is a routine request to hire contract nurses on a temporary basis. Quote, contract hiring decisions like these are routine and coupled with the hiring of more than 72,000 new VA healthcare workers since late March have enabled the department to successfully treat more than 105,000 COVID patients and test nearly 1.1 million people for the virus. The VA also told WRTV its employee infection rate is less than 1%, lower than the 6% in all healthcare systems, as reported by the CDC. When we asked how this is impacting patients, our Indiana veterans, we were told there is no impact. All VA medical centers have adequate capacity to meet current demand. Nurse Yvonne Evans caught COVID-19 in spring and still has breathing difficulty, limiting her ability to work.
This virus is no joke. And as frontline healthcare workers, we're right there in the battlefield.
As COVID-19 continues to impact our state's veterans, they're hopeful the hospitals that serve them can stay fully staffed with nurses. Working for you, Kara Kenny, WRTV.